Dengue fever is a serious health concern affecting millions worldwide. It is a mosquito-borne viral infection found in tropical and subtropical regions. The dengue virus is transmitted through the bite of infected Aedes mosquitoes, primarily Aedes aegypti. These mosquitoes thrive in warm, humid climates and breed in stagnant water. Dengue fever poses a significant public health challenge, impacting individuals, families, and healthcare systems. Dengue fever is prevalent in over 100 countries, with a particularly high burden in Southeast Asia, the Western Pacific, and the Americas. The World Health Organization estimates that up to 400 million people are infected with dengue annually, while many experience mild symptoms and recover fully. A small percentage develop severe dengue, which can be life-threatening. The impact of dengue extends beyond the individual level. Outbreaks can overwhelm healthcare facilities, leading to shortages of beds, medical supplies, and healthcare workers. The economic burden of dengue is substantial, with costs associated with medical treatment, lost productivity, and vector control measures. Addressing dengue fever requires a multifaceted approach involving prevention, early diagnosis, and effective treatment. Understanding the disease, its transmission, and the factors contributing to its spread is crucial for implementing effective control strategies. By raising awareness, promoting preventive measures, and strengthening healthcare systems, we can mitigate the impact of dengue and protect global health. Dengue fever typically manifests with a sudden onset of symptoms, often after an incubation period of 4 to 10 days following a mosquito bite. Recognizing the early warning signs is crucial for seeking timely medical attention and preventing complications. The initial symptoms of dengue fever often resemble those of other viral infections, making clinical diagnosis challenging. One of the hallmark symptoms of dengue fever is a high fever, often exceeding 104 degrees Fahrenheit or 40 degrees Celsius. The fever is usually accompanied by severe headache, particularly behind the eyes, earning it the moniker breakbone fever due to the intense pain it causes. Muscle and joint pain are also common, adding to the overall discomfort. Fatigue is another prominent symptom of dengue fever. The body's immune response to the virus can leave individuals feeling drained and lacking energy. This fatigue can be debilitating, making it difficult to perform daily activities. Other symptoms that may accompany the initial phase of dengue fever include nausea, vomiting, and loss of appetite. As the illness progresses, individuals may develop a rash. The dengue rash typically appears on the 3rd or 4th day of fever and is characterized by small red spots that blanch when pressure is applied. It may initially appear on the trunk and then spread to the limbs and face. Some individuals may also experience mild bleeding, such as nosebleeds or bleeding gums. Diagnosing dengue fever relies on a combination of clinical evaluation, patient history, and laboratory testing. Doctors begin by taking a thorough medical history, inquiring about recent travel to dengue endemic areas, mosquito exposure, and the onset and nature of symptoms. A physical examination is then performed to assess the patient's overall condition. During the physical examination, doctors pay close attention to the patient's temperature, heart rate, blood pressure, and respiratory rate. They also examine the skin for the characteristic dengue rash and look for signs of dehydration, such as dry mucous membranes and reduced skin turgor. The doctor may palpate the abdomen to check for liver enlargement, a common finding in dengue fever. Clinical evaluation alone can be challenging, especially in areas where other mosquito-borne illnesses like chikungunya and Zika virus are prevalent. The symptoms of these diseases can overlap significantly with dengue, making laboratory confirmation essential. The doctor's suspicion of dengue fever is heightened If the patient presents with a combination of high fever, severe headache, muscle and joint pain, rash, and a history of recent travel to a dengue endemic area. However, it's important to note that the severity of symptoms can vary greatly among individuals, and some people may experience only mild illness. Laboratory tests play a crucial role in confirming a dengue fever diagnosis, differentiating it from other infections, and determining the severity of the illness. These tests help healthcare providers initiate appropriate treatment and monitor the patient's progress. One of the primary tests used to diagnose dengue fever is the tourniquet test. This test assesses the fragility of capillaries, which are tiny blood vessels that connect arteries and veins. In dengue fever, capillaries become more permeable, leading to leakage of fluid and blood components into surrounding tissues. During the tourniquet test, a blood pressure cuff is inflated on the upper arm for a few minutes, and the number of petechiae, or small red or purple spots that appear on the skin, is counted. A higher number of petechiae suggests increased capillary fragility, supporting a dengue diagnosis. Blood tests are essential for confirming the presence of the dengue virus or antibodies produced by the body in response to the infection. The most common blood test is the dengue NS1 antigen test, which detects the presence of a non-structural protein produced by the dengue virus in the early stages of infection. Another important blood test is the dengue antibody test. This test looks for antibodies produced by the body's immune system to fight off the dengue virus. There are two main types of dengue antibodies, IgM and IgG. IgM antibodies are produced early in the course of infection, while IgG antibodies appear later and provide longer-term immunity. In addition to these specific tests, doctors may order a complete blood count or CBC to assess the patient's overall health and look for signs of infection. The CBC measures the levels of different cells in the blood, including red blood cells, white blood cells, and platelets. Dengue fever can cause a decrease in platelet count, which can increase the risk of bleeding. Section 5. Combating dengue treatment, supportive care and hydration. While no specific antiviral treatment exists for dengue fever, early diagnosis and appropriate supportive care are crucial for managing symptoms, preventing complications, and improving outcomes. The primary goal of treatment is to relieve symptoms and support the body's natural healing process. Hospitalization may be necessary for severe cases, especially those experiencing warning signs of dengue hemorrhagic fever. One of the cornerstones of dengue fever treatment is maintaining adequate hydration. The high fever and potential for fluid loss through vomiting and diarrhea can lead to dehydration, which can worsen symptoms and increase the risk of complications. Oral rehydration therapy, often recommended for mild cases, involves the consumption of fluids containing electrolytes and glucose to replenish lost fluids and essential minerals. In more severe cases, intravenous fluids may be necessary to restore and maintain hydration. Rest is essential for allowing the body to fight the infection and recover. Patients are advised to avoid strenuous activities and get plenty of sleep. Pain relievers like paracetamol can help alleviate fever and reduce muscle and joint pain, providing much needed comfort. However, it's crucial to avoid aspirin and non-steroidal anti-inflammatory drugs or NSAIDs like ibuprofen, as these medications can increase the risk of bleeding. Monitoring for warning signs is paramount, especially in the critical phase of dengue fever, which typically occurs around the 3rd to 7th day of illness. Warning signs that require immediate medical attention include persistent vomiting, severe abdominal pain, difficulty breathing, bleeding gums or nose, and reduced urine output. These symptoms may indicate the development of dengue hemorrhagic fever, a serious complication that can lead to shock and organ failure. Section 6. Navigating dengue treatment. Why NSAIDs are a no-go? While pain relief is an essential aspect of managing dengue fever symptoms, certain pain relievers, particularly non-steroidal anti-inflammatory drugs or NSAIDs like ibuprofen and aspirin, are strictly contraindicated. These medications, while effective in reducing pain and inflammation in many conditions, can exacerbate bleeding complications associated with dengue fever, potentially leading to life-threatening situations. Dengue fever, in its severe forms, can affect the body's ability to produce platelets, which are essential components of blood clotting. NSAIDs further inhibit platelet function, increasing the risk of bleeding from the gums, nose, gastrointestinal tract, or internally. This risk is amplified in individuals with pre-existing bleeding disorders or those taking other medications that interfere with blood clotting. Paracetamol, also known as acetaminophen, is the preferred pain reliever for dengue fever. Unlike NSAIDs, paracetamol does not significantly affect platelet function and is considered safe for managing fever and pain associated with the illness. However, it's essential to use paracetamol cautiously and within recommended dosage limits, as overuse can lead to liver damage. If you're unsure about which pain reliever to take for dengue fever, consult a healthcare professional for guidance. They can assess your individual risk factors, consider any underlying medical conditions, and recommend the safest and most effective pain management strategy. Self-medicating, especially with NSAIDs, can be dangerous and should be avoided. Section 7. Stopping dengue at the source. Environmental control measures. Preventing dengue fever primarily focuses on controlling the Aedes mosquito population, the primary vector responsible for transmitting the virus. These mosquitoes thrive in urban environments, breeding in stagnant water collected in containers, tires, flower pots, and other artificial receptacles. Eliminating these breeding sites is crucial in reducing mosquito density and interrupting the transmission cycle. Regularly emptying and cleaning containers that can hold water is paramount. This includes flower pots, buckets, discarded tires, bird baths, and any other objects that can collect rainwater. Scrubbing the insides of containers is essential to remove any mosquito eggs that may be attached to the surface. Disposing of solid waste properly is another crucial step. Garbage, especially organic waste, provides a breeding ground for mosquitoes. If not disposed of in sealed containers and collected regularly. Maintaining proper sanitation and waste management practices, both at home and in the community, is vital in reducing mosquito breeding sites. Structural improvements can also contribute to mosquito control. Installing window and door screens can prevent mosquitoes from entering homes, providing a physical barrier against their entry. Using mosquito nets, especially during peak mosquito activity periods, can offer additional protection, particularly for individuals sleeping outdoors or in poorly ventilated areas. Section 8. Shielding yourself. Personal protection against dengue. While environmental control measures target mosquito breeding sites, personal protection strategies focus on minimizing individual exposure to mosquito bites. These measures are particularly important during peak mosquito activity periods, which are typically around dawn and dusk. Wearing long-sleeved clothing and long pants, especially when outdoors, provides a physical barrier against mosquito bites. Light-colored clothing is generally preferred, as mosquitoes are attracted to dark colors. Tucking pants into socks can further reduce the exposed skin area and minimize the chances of mosquito bites. Using mosquito repellents is another effective personal protection measure. Repellents containing DEET or N-N-N-diethyl metatoluamide are considered highly effective and safe when used as directed. Apply repellent to exposed skin, avoiding contact with the eyes, mouth, and any open wounds. Reapply repellent according to the manufacturer's instructions, especially after sweating or swimming. Mosquito nets, as mentioned earlier, provide an additional layer of protection, especially during sleep. Bed nets treated with insecticides like permethrin offer even greater efficacy, killing mosquitoes that come into contact with the net. Ensure that nets are properly tucked under the mattress and free of holes to prevent mosquitoes from entering. Staying informed about dengue outbreaks in your area is crucial. Local health authorities often issue advisories and implement vector control measures during outbreaks. Following their recommendations and taking extra precautions during these periods can help reduce the risk of infection. Section 9. Knowledge is power, community awareness, and education. Raising community awareness about dengue fever, its transmission, and prevention strategies is paramount in effectively combating this public health threat. Educated communities are empowered to take proactive measures to reduce mosquito breeding sites, minimize exposure to mosquito bites, and seek timely medical attention when necessary. Community education programs can play a vital role in disseminating accurate information about dengue fever. These programs can be tailored to specific communities, considering local cultural contexts and language preferences. Engaging community leaders, healthcare providers, and volunteers in these initiatives can enhance the reach and effectiveness. Educational materials such as pamphlets, posters, and videos can provide valuable information about dengue fever in an accessible and engaging manner. These materials can be distributed in public places, healthcare facilities, schools, and other community gathering spots. Social media campaigns can also be leveraged to disseminate information quickly and widely. Community-based initiatives such as neighborhood cleanup drives, targeting mosquito breeding sites, can be organized to promote collective action. Engaging residents in these activities fosters a sense of ownership and responsibility for maintaining a clean and healthy environment. Schools can play a crucial role in educating children about dengue fever and empowering them to become agents of change. Incorporating dengue prevention messages into school curricula, organizing school-based awareness campaigns, and encouraging student-led initiatives can raise awareness among younger generations and promote preventive behaviors from an early age. Section 10. A shield against dengue, the Dengvaxia vaccine. The development of a dengue vaccine represents a significant advancement in the fight against this mosquito-borne disease. Dengvaxia, the first dengue vaccine approved by the World Health Organization, offers a new layer of protection against dengue fever, potentially reducing the burden of this debilitating illness. Dengvaxia is a live attenuated tetravalent vaccine, meaning it contains weakened versions of all 4 dengue virus serotypes. It is administered in a 3-dose schedule, with the second and third doses given 6 and 12 months after the first dose. The vaccine is recommended for individuals aged 9 to 45 years living in dengue endemic areas. Clinical trials have shown that Dengvaxia is effective in preventing dengue fever caused by all 4 serotypes. The vaccine's efficacy varies depending on the serotype, previous dengue exposure, and other factors. However, it is important to note that Dengvaxia is not recommended for individuals who have never been exposed to dengue virus. The World Health Organization recommends that Dengvaxia vaccination be considered in areas with a high burden of dengue disease and where epidemiological data indicate a significant risk of infection. Vaccination decisions should be made on a case-by-case basis, considering individual risk factors and local disease epidemiology. Section 11. Vigilance is key. Early detection and prompt medical attention. Early detection and prompt medical attention are crucial in managing dengue fever and preventing severe complications. Recognizing symptoms and seeking medical attention promptly are essential. If you experience sudden high fever, severe headache, muscle and joint pain, or rash, consult a healthcare professional immediately. Early diagnosis allows for timely supportive care and better outcomes.